Welcome to the Pharmacy Frontiers podcast, a podcast dedicated to the profession of pharmacy. Today, we're excited to turn over the podcast to the students from the St. Louis College of Pharmacy at the University of Health Science and Pharmacy in St. Louis with their podcast titled Dose of Knowledge. We give credit to Professors Stephanie Lucas and Terry Wahalik for mentoring these students for these leadership podcasts. Let me remind everyone that the Pharmacy Frontiers podcast is available for streaming on your favorite podcast streaming app, whether it be Apple, Podbean, Spotify, or YouTube. The comments and opinions shared today are those of the hosts and our guests and are not official statements of the Missouri Pharmacy Association, Mitchell Pharmacy, Mercy, nor the University of Health Sciences and Pharmacy in St. Louis. Now let's hand the microphone over to our students.
It's a typical morning in the pharmacy when a pharmacist pauses mid-order. A patient recovering from knee replacement surgery has been prescribed a new medication, but something doesn't sit right. The drug name looks familiar, but not quite right. A quick double check reveals that the truth. The doctor orders Celexa, an antidepressant, instead of Celebrex, an anti-inflammatory agent, meant to ease post-surgical pain. One careful review, one extra minute of vigilance, and a serious medication error is prevented. Pharmacists aren't just part of healthcare, they are healthcare. This is How Pharmacists Save Lives podcast, and in today's podcast, we step into the realm of hospital pharmacy. My name is Ariana Chambers, and I am a second-year pharmacy student at the St. Louis College of Pharmacy, otherwise known as Still Cop at the University of Health Sciences and Pharmacy. I myself worked in the field of pharmacy for about a year and a half, and in a mail order pharmacy, and now currently with a health insurance company. And I personally chose pharmacy because I've always been fascinated by the science behind how multiple components come together to form a single pill, and how that one pill can save and make such a difference in a patient's life.
My name is Landon Ingelagi, and I'm a second-year pharmacy student at Still Cop at UHSP. I've worked in the field of pharmacy for over 2 years at a retail pharmacy, and I chose pharmacy because I wanted to serve my community. Pharmacists are one of the most accessible healthcare professionals, and helping patients to better understand their health is very rewarding.
My name is Ali Aldini, and I'm a second-year pharmacy student at the St. Louis College of Pharmacy, also known as the University of Health Sciences and Pharmacy. I've worked at both settings of hospital and mainly pharmacy, and I chose pharmacy because I've always wanted to help my community and be a mentor to my community as well.
My name is Dwight Newsome, and I'm a second-year pharmacy student at Still Cup at UHSP. I've worked in both retail and hospital pharmacy for over 3 years. When I first started at the university, I met several pharmacists that showed me all the things that you could do with the PharmD, and that inspired me to pursue the career. I love having the opportunity to help people and answer questions and become a face people can trust in their community.
Before we dive into today's discussion, it's important to first reframe how we think about pharmacists. Too often, the public sees them as people simply handing out medications, but that's only a fraction of what they do. The truth is, pharmacists play a far deeper role and more impactful role in patient care, one that deserves to be recognized and respected. Pharmacists are doctors and medication experts whose responsibilities extend far beyond simply filling prescriptions. Their expertise encompasses patient care, drug therapy management, and clinical decision-making. Pharmacists serve as the final safeguard between a patient and potentially a life-threatening medication error. Whether in hospital or community settings, they ensure safety, accuracy, and optimal therapeutic outcomes. And today we want to share some untold stories that highlight the pharmacist's critical and often overlooked contributions to patient health. By putting a spotlight on these moments, we can help others appreciate the true impact pharmacists have within the healthcare system.
It's time to hear from someone who lives this every day. Joining us today is Dr. Jong, a clinical specialist in the medical ICU at Barnes Jewish Hospital. With over 15 years of experience in pharmacy practice and leadership, Dr. Jong has witnessed firsthand how the profession has evolved and how pharmacists continue to shape patient outcomes in clinical care settings. Dr. Jong, thank you so much for joining us today. To start, can you share a little bit about the areas you've worked in and how those experiences have shaped your outlook on pharmacy and patient care?
Sure, right. So I've been, obviously as part of the residency training, I've been in every single area in the ICU, also everywhere in the hospital. My most recent, currently, I practice in the medical ICU at Barnes Jewish Hospital. So that's the type of patient I currently see.
Do you feel like pharmacists are getting the recognition they deserve for their roles that they play in patient care, or do you think there's still a gap in how people view what pharmacists actually do?
I think currently, that's a great question. I think there's still currently a gap. I go around meeting people in which I tell people I'm a pharmacist. They will ask me, what Walgreens do I work at? And what do I do? Since they have no idea what I do on a daily basis. I had to tell people I work in a hospital and we actually deal with all these hospitalized patients. They don't, my mom doesn't even realize I actually talk to physician teams in terms of trying to help manage all these patients and help manage what drugs these patients should be on. So even my mom doesn't know what I'm doing.
We opened today's episode with a story about a pharmacist catching a dangerous mix-up, and that's just one example of how quick decisions can literally save lives. So to bring that in full circle, I want to pass it over to Ali because these kind of situations aren't rare. They happen more often than people realize, and pharmacists are often the ones catching those errors before they reach the patient.
Thank you. So the story really highlights what pharmacists do every day, protecting patients in ways most people never see. So how have moments like that shown up in your own career or shaped the way you approach patients' care?
I think this actually gives me a big emphasis in terms of understanding drug safety. That's one big thing that I actually learned throughout residency. It's sort of like my job as a clinical person is to catch these last minute errors. I could kind of tell you during my practice about 5 years ago, we had a patient getting ibuprofen, and they were worried about kind of injecting into people, and then didn't realize that was morphine, that they were going to infuse it into somebody continuously. And you guys know that would actually be detrimental, probably cause death for some patient out there. But something as easy as that. Ibuprofen, the syringe looks exactly like morphine, but something as easy as that could kill somebody.
Yeah.
Just for some background information, ibuprofen is a drug that prevents blood clotting and widens blood vessels to make blood flow easier. Morphine, however, is a very strong pain medicine that eases pain but can slow breathing and potentially be lethal if used in large doses. You may commonly hear morphine being associated with the military and battlefield trauma for its relief of severe pain. In this case, a mix-up between those two drugs could have proved to be fatal, like Dr. Zhang mentioned.
I can also relate to that story. There was actually a time in my own experience that really opened my eyes to how quickly and small details can turn into serious issues if it was not caught. So just tell a summary of my own story. Once a nurse practitioner prescribed me a wrong medication with the wrong dose. And then when I went to the pharmacy, the pharmacist caught the error right away before it was filled. They contacted the provider to verify and correct the prescription, preventing any serious mistake and keeping me safe. And what's crazy is medication errors don't just happen because of the prescription, sometimes about how the patient takes the medication at home. One source actually reports the medication error contributes to around 250,000 deaths per year, with 55% happening during administration, 25% in prescribing, and 16% in dispensing. Plus, at-home errors occur at rates as high as 2 to 33%. But the encouraging part is that pharmacists catch 30 to 70% of these errors before they reach the patient. With that being said, when a serious error is caught just on time, how do you handle that moment, both professionally and emotionally? Does it change how you approach your work afterwards?
I think that's a very good question in terms of trying to pick these daily errors that could happen. I'm saying daily, I probably being a little too facetious in terms of saying that. I'm not sure it's happening every single day, but it could go as high as a daily error. But I think that's the whole thing. That's our job professionally. We're here to catch errors. There's actually, I don't know if you guys are aware, there's studies showing that pharmacists in the ICU catch lots of errors. And also we save lots of money by doing that. I think that's the professional gain that I can actually feel in terms of my role within the ICU. I think emotionally it's kind of tough. A lot of times you see all these patients. Right now we have a patient in the hospital right now who's going on comfort care. We're giving this patient tons of morphine. So, having one error, it's actually useful for that patient since it's sort of like helping them transition into the next phase. But you know that somebody else, if we have a minor error, that could potentially cause a death for somebody. It's a very, very high dose.
Yeah, definitely. That really shows how much pressure and responsibilities come with being a pharmacist. Every decision, every verification can make such a huge difference in patients' outcomes. And the level of attention is even more intense in critical care setting, like the ICU. So with that, I'm going to hand over to Landon. He's going to dive a little deeper with Dr. Huang.
Thanks, Ali. So, Dr. Zhang, I can only imagine how intense things get for you in the ICU. Can you paint a picture for us of what a typical day looks like for you as a pharmacist there, and how you work with other providers when those quick, high-stakes decisions come up?
Sure, I could kind of describe my morning if that's probably the easiest way to describe that. This morning I got in to kind of look at new patient who kind of admitted over the weekend. Since these people over the weekend I'm not as familiar with in terms of what's going on with them, and also look at the medication regimen. A lot of them get placed on some regimen that half the time I don't even know what they're on right now, so I have to kind of look through just to see what's their current regimen. A lot of these medication regimen, one, it's very costly. The second part is actually very high stake. We have a patient who's on vasopressors, something control their blood pressure. If you finagle that being wrong, that could affect to the detriment of that patient. So that's on a daily basis. Of course, one of the big key where we play is also we have a lot of say in terms of antibiotic therapy for these patients. So that's actually going to help these patients stay alive longer. So that's something I kind of do on a daily basis. I also interact with a lot of different health professionals in the hospital. Of course, we always think about physicians, but I also have dietitians as well as I currently also have other pharmacists. I have a resident as well as other students available.
Yeah, I feel like that kind of teamwork is what really keeps everything running smoothly, especially in a critical care setting. Hearing that makes me think about some of the bigger challenges that pharmacists face, especially when policies get in the way of patient-centered care. For example, there's research that talks about how efforts to fight the overdose crisis have sometimes gone too far in the other direction. Hospitals have tried opioid-free policies or used prescription drug monitoring programs so strictly that the patients end up being dismissed from care altogether. So when those kinds of policies focus more on restricting prescriptions than actually treating patients, some people can really fall through the cracks. From your perspective, how do pharmacists help make sure those patients still get the care they need in a way that's both safe and effective?
I think that's a big key. Our role within the hospital, because we're sort of like touching both sides, understand why these patients are getting the specific medication. We know that this patient, of course, I'm not saying that we can't be tricked. Of course, that could happen. But we essentially could play a role in terms of playing both a physician team as well as these being a healthcare advocate for these patients. Understand we have a patient who's getting methadone. That's a classic example. That patient's getting methadone for a legitimate reason. He's also transitioning to comfort care. So that itself is actually useful for that patient. And a lot of times, I could actually help in terms of expedite that medication to the patient, just so that patient will get pain medicine on a transition.
Hearing how you balance policy, patient safety, and real-time decisions shows how complex pharmacy can be, especially in critical care. It's clear that pharmacists play a much bigger role than most people realize, and that actually brings us to something we wanted to talk about next, the misconceptions that still surround the profession.
After we've discussed the collaboration, the responsibilities, the life-saving calls, a lot of people still don't fully understand what pharmacists actually do. So honestly, and one of the biggest misconceptions that we still hear at this time is that pharmacists aren't really doctors and they only work at Walgreens. But the reality is pharmacists earn a doctor's of pharmacy degree. They go through years of education, clinical training, and patient care experience. The difference is that instead of diagnosing, pharmacists focus on optimizing treatment and ensuring medication safety. So I'm curious, Dr. John, why do you think that misconception still exists, even though pharmacists hold a doctor's degree and play such a vital clinical role? And what do you think it would take for the healthcare system, and even patients, to start viewing pharmacists as part of that doctor team, rather than just the medication experts behind the counter?
I think that's a very good point, since I think there's also recent papers that other professions actually put down in terms of what pharmacists do, which is mostly we're drug experts. We should be helpful in terms of managing medication within these patients. I think that's the key part, understanding, get rid of some of the misconception in terms of what we will steal your job. That's not what we're trying to do. We're trying to help. So that's actually the biggest thing that's going out there. There's actually a paper in Northeast, in Boston area, actually talking about how we're potentially stealing jobs. We're not a full practitioner.
I think Dr. Jung was trying to emphasize that when other professionals limit pharmacist scope to only medication-related tasks, it reinforces the idea that pharmacists are stealing jobs. In reality, that's not the case. Pharmacists complete far more medical and clinical education than most people realize. The paper he mentioned also highlights how some professionals view pharmacists as taking over roles, when the truth, pharmacists are trained to collaborate and expand patient care, not replace anyone.
Yeah, that's a good point. Another misconception is that people tend to separate hospital and community pharmacists like they're into two totally different worlds, but there's a lot of overlap. How do you and your team stay connected or collaborate with community pharmacists to make sure patients get continuous care?
So I have actually frequently called like Walgreens to figure out is this patient on this med and how long they been on it. Are they refilling these meds consistently? Since without the Walgreens or even CVS people, I won't know that answer because I don't know what's going on with these patients uh, throughout their life. Are they taking the meds or are they not taking the meds? I actually need their expertise in terms of getting that. I know they're looking on the computer to get the data, but still, that's something that I do not have access to.
That really ties everything together. Pharmacists working across settings, breaking all stereotypes, and continuing to expand their impact on patient care. And speaking of where the field is heading, I'm going to pass it over to Dwight, who's going to take us into our final topic, the future of pharmacy.
Thank you, Ali, and thank you, Dr. Zhang, for that insight. As we look at the field of pharmacy as a whole, it really feels like we're hitting a turning point in the profession. Between new technology, changes in healthcare delivery, and the growing need for accessible patient care, pharmacy is evolving faster than ever. New technologies, different ways for patients to get their medications, and roles expanding in both hospital and community settings. How do you think the pharmacist's role is going to evolve over the next 10 years? And maybe even more importantly, how would you like to see it evolve?
I think something that I could see evolving is that when there's tons of new meds, we could actually take part in terms of talking to patients, trying to educate them in terms of using these new medication, but also try to help them manage their disease state more properly. You will probably also hear a lot of faculty that are on specific clinics, pulmonary, use inhalers, or cardiology, use better meds for a specific condition like heart failure. There's something we could actually take part in terms of helping these patients out there.
Along with the growth, there's always the other side. There's challenges that come with it. Do you think there are any potential barriers or obstacles that could slow down or limit that progress? Things like policy, workload, or even public perception. What do you think needs to change to keep the profession moving forward?
I think that's a very good question. I don't know if you guys heard about North Carolina in terms of trying to advocate for pharmacists to get paid for some of these things. I think money is always playing a part.
Right.
I think, especially with the current administration,
Yep.
money is going to play a part in terms of all this. Like, we're not going to drive all this thing forward until there's money involved, which could be Medicaid or Medicare in terms of this money. So that's how you get essentially reimbursed for these things. Without that, we're not going to move forward.
That's a great perspective because I feel like a lot of people don't know what really goes on behind the scenes and that money and the finances are a driving factor. It's clear that pharmacy is moving forward in incredible ways, from direct patient care to policy and innovation. But what really stands out is at the core of all this change, pharmacists remain the constant link between medication and patient safety. And that really brings us full circle to what this whole conversation has been about, the impact that pharmacists make every single day, often behind the scenes. Before we wrap up, we just want to give a huge thank you to Dr. Zhang for joining us today and sharing such valuable insight. Today's episode really highlighted how pharmacists wear so many hats, from catching medication errors to collaborating with doctors, advocating for patients, and ensuring that every dose is safe and effective. From the hospital floors to the corner pharmacy, pharmacists are quietly preventing errors, solving problems, and protecting patients every single day. In the ICU, that might mean adjusting a critical care dose in real time. In the community, it might mean catching a dangerous mix-up before it ever reaches you and just calling it an insurance problem. Different settings, same mission, keeping you safe. Because pharmacists don't just work in healthcare, they are healthcare. Thank you for listening to How Pharmacists Save Lives.
A big thank you, students, for hosting the Dose of Knowledge podcast as part of the Pharmacy Frontiers. And thank you to our listeners for joining us today. Please share this episode with your friends and seek out other Dose of Knowledge podcasts on the Pharmacy Frontiers podcast page that can be found on your favorite podcast channel.